Hi, Dr. Ravi here, and we're going to talk today about COVID-19 and prevention and how to keep yourself as healthy as possible during this time frame. Specifically, I want to talk about vaccinations for adults. Now, this is something we all know about vaccines for children. We take our children religiously to the doctor. We get the vaccines done on a prescribed schedule. Nobody wants to deviate from that. But do we take care of ourselves as adults? India has, unfortunately, a very, very low rate of adult vaccination. And I'm going to focus on two very important vaccines. Vaccines against a bacterial form of pneumonia called pneumococcus. So these are pneumococcal vaccines. It's a 2-vaccine series we give. And influenza vaccines. Those are seasonal vaccines that are given every year. Whereas rates of vaccination in Europe, Canada, the United States may be above 90% in adults for these conditions, they tend to be very, very low in India. And many, many parts of society just don't get the vaccines or think about them. That's something which is a problem on an annual basis. Influenza comes every year, and many people get quite sick and die of influenza. Pneumococcal pneumonia can strike adults and elderly at any time, and again, is the 4th leading cause of death in adults worldwide, is pneumonia. So these are always a problem, and the people who are most at risk, ready for this? People over the age of 65, people with diabetes, heart disease, liver disease, people getting treatment for cancer. Do these things sound familiar? Well, they're the same risk factors as the COVID-19 disease risk factors. It's exactly the same. In COVID-19, there's a little bit more toward hypertension as well, high blood pressure, but overall, the risk factors are the same. So we have a large group, probably tens of millions of adults at risk for influenza, pneumococcal pneumonia, who are the same people that are at risk for COVID-19. So now is the time, and I would say, as an infectious diseases expert, there has been no point in history when it has been more important to get these vaccines as an adult. Because the worst thing that could happen, having COVID-19 is a terrible thing. And we see how many people die of this disease or get really sick. But imagine having COVID-19 during a seasonal outbreak of influenza. The potential for both. Imagine the society that has to deal with 2 epidemics at the same time. It cannot be done. So now is the time when vaccines for influenza and pneumococcal pneumonia are essential. Not recommended, essential. Talk to your doctor. Your primary care physician can arrange these. These can be provided. The risks of these vaccines are extremely low. Influenza vaccine, because it's prepared using a culture of egg cells, people who have allergies to eggs, who can't eat eggs, should not get the traditional influenza vaccine. That's a very low percent of the population. And there are alternatives for those people. So it's not like they don't get immunized against influenza. They just have to have the discussion with their doctor. Pneumococcal pneumonia, or pneumococcal vaccine, has negligible, if any, side effects. Maybe a little sore where it's given, which is part of having a shot, but otherwise negligible side effects. Now, it's important to remember the pneumococcal vaccine series, the two that I'm mentioning, they're given every 10 years. Influenza is given every year because a new batch is prepared based on the circulating strains. So, Indian adults, it's time to think differently. Every year, influenza vaccine, it's a must. Every 10 years, think about the pneumococcal vaccines. And if you're in any of those risk groups, age, over 60 to 65, diabetes, heart disease, liver disease, kidney disease, cancer, taking drugs like steroids that suppress the immune system, you need vaccines. You need them this year, and you should talk to your physician about them. You're in the same risk groups as COVID-19. There will, God willing, there will be a vaccine against COVID-19 maybe in the new year. We don't know yet. But before we get to that point, there are diseases that can make this a lot worse, namely influenza and pneumococcal pneumonia, where the vaccines are available right now, and you can have a discussion with your doctor. They're easy to take with very few side effects. So my advice now is, while we all pray together for a vaccine against COVID-19, let's do what we can do to immunize against those killer infectious diseases that are out there every year. Influenza, pneumococcal pneumonia. Talk to your doctor. Let's get vaccinated. Thank you.